guys. I'm sitting outside on my back porch. It is beautiful out. And I'm sitting here just to relax. I just came back from a dentist appointment with Wyatt. And yes, I'm in my workout gear because I still need to work out. I actually went there on purpose in my workout gear because any appointment with Wyatt is like a workout. So I actually always kind of go to appointments dressed down and ready to get my workout in with her, with the whatever appointment we have, because with Wyatt it tends to be a running after him and chasing him down or holding him down, and of course today was no different. So I wanted to come on here today and just give you a little bit of a glimpse of what it's like to take this kid to an appointment with all this gear in tow, and what a difference it is now compared to even just a couple of years ago. So it's that time of the year that I absolutely dread, and it's the time where he has to have all his doctor's appointments, has to see all his specialists, and he has to go through his routine testing that he has to do. I should be drinking wine instead of water today, but we'll stick with water. I dread this time of year, I'm not gonna lie. It happens every 6 months, barring any emergencies or unexpected events. He goes and sees various different specialists every 6 months. So on the top of our list is now pulmonology is probably the one that we see the most. Cardiology, his eye doctor, and there's one that I always forget, but anyway, the primary care we see on a yearly basis. I mean, they practically don't even know us. They just get a bunch of files sent over every time we see a specialist. So they're more or less just there as technically the quarterback, if you want to call him that, who kind of gathers all the information and then shoots it out wherever it needs to go. But yeah, pulmonology is probably number one, and we see them frequently, and those are the ones we talk to all the time when it comes to any kind of doctor's orders that we need for school. They are essentially like our primary is pulmonology, because that's why it's issued as a trach and event. So, oh, the other one I forgot is ENT. Yeah, I kind of slack off on that one sometimes too. But it brings me to today, the number one appointment. I have to be completely honest, the number one appointment that I absolutely dread with Wyatt is dentist. And the reason why I dread it is kids with trachs tend to have more dental issues to begin with. We knew that right off the bat. We knew that was going to most likely at some point be an issue. And Wyatt being autistic on top of that, he, one, doesn't like to lay on his back at all. And two, brushing teeth with him has been a struggle. The first 3 years, none of it happened. We were lucky if we could, rub a finger over it a little bit with those little sponge thingies that they give you at the hospital. So we were lucky if that happened. So by the time he was 3 years old, we had to take him in to see the dentist because we could see his teeth were just horrible, in horrible condition. I mean, when I'm talking about not being able to brush his teeth, I'm talking like two people holding him down, and we're still not able to get in there. He just doesn't like anybody touching his face, anybody coming close to him in that sense. And then on top of that, laying back is a big no-no for him anyway. So 3 years ago, we had to find a dentist that was affiliated with our hospital, because when Wyatt needs dental work, it's not like any other kid where you just give a little bit sedation and they get it done. He has to go full-blown into surgery mode, so you have your whole team of anesthesiologists and your whole backup team. So he had extensive dental work done in the hospital, fully sedated, on the vents, ICU on standby, because you never know how he's going to respond after anesthesia. And that was about 2 years ago. A couple grand out of pocket to get all that fixed, a bunch of crowns everywhere, because we haven't been able to brush his teeth for 3 years, right? So ever since then, I'm kind of dreading going back to the dentist. I'm like, I don't want to go in on here he has another cavity, because if he does, it means another trip to the hospital. So I went in today, and I did all the mindset work that I talked to you ladies about. And I have to say, I started the day off a little bit on edge. I woke up in the morning and I was fine the week before. Normally, at least a week in advance before appointments, I used to be so stressed, just in anticipation of how it's going to go and everything it's going to take to load him up and load up all his gear, and what if he passes out on me, or what if he just throws himself on the ground and doesn't walk and it's just me and the entire trolley with all his equipment. How am I going to get him back to the car? Or things like that always stressed me out for a good week in advance, just in anticipation. And so in that sense, I've been doing a lot better. I actually wasn't stressed at all about this appointment. Even this morning as we were going to the appointment, I was still calm about it. In the waiting room, he was playing. I was just watching him and playing with him and signing with him. So that was a huge difference for me. I actually managed to keep myself calm, with then of course helps Wyatt as well to stay mentally a little bit more distracted, I guess, for him. But the reason why I wanted to come on here today is I wanted to just give you a little glimpse of what this dentist appointment looks like with Wyatt. Right? Most kids don't like dentists at that age. They don't sit still. They don't want to lay down. So fair enough. I was expecting that. And I went into it with the mindset, okay, I need to stay calm so he stays calm and we can get this done as smoothly as possible. So we get called back, and the hygienist is like, so it's been like a year since we've done x-rays. So do you think he's going to cooperate and do some x-rays today? I was like, sure, let's give it a try. So she takes us into another room. There's a chair. He's sitting down, and she's trying to put this thing in his mouth to do the x-ray. And of course, Wyatt is just sitting there holding his mouth closed. It wasn't going to happen. He was all excited about the little lead he had to put on because it was zebra stripe, but opening his mouth to do an x-ray, nope, already was a no-go. So we go back to the actual examination chair, and the dentist is there, and she's like, well, I really would have liked those pictures, but I guess we're not going to get any today. It's like, yeah, I guess not, because I'm not forcing him to. If I force him to do anything, he's going to hold his breath and turn blue and pass out, and nobody wants that. So he lays down on the chair. Now, mind you, this is the pediatric dentist's office, so they have pictures all the way around the walls of, like, safari animals, and they have the little TV screen right above his head as he's laying back on the chair. He didn't care. It didn't matter for one bit. He does not like laying back, and especially when the hygienist is basically coming over his head, trying to mess with his mouth. So I'm leaning over him. I have to wrap his hands like this, like he's in a straitjacket, and I'm leaning on top of him, holding him down like that. So I'm on the step stool next to the chair that he's laying down on, and I'm on top of him holding my kid down, like, okay, we're just gonna clean your teeth real quick. This happy, I hate it. You have to put on this happy fake, I don't even know what it is. It's like a theater production show, I feel like, every time. I always hated it when people did, like, the whole baby talk with their kids. I never did that with any of my kids. It was always straight talk, just the way I am in all these videos as well. It was always straight talk for me. So to now have a kid who's autistic, who you have to stay calm and you have to make it all fun and happy games for him to not have a meltdown, it's really hard for me to do. Like, it drains my energy to have to do that. So the whole time I'm leaning over him, holding him like he's in a straitjacket and pretending everything is just fine. And pretending this is just a game. We're just gonna look at your teeth and look at that one, let's get it all white and shiny. And the whole time I'm just thinking, this is so ridiculous. I absolutely hate being here. Can we just hurry up and get the shit over with? And then, of course, the hygienist joins in, and she makes it like a game, and we do a counting game. I'm like, oh my god, I feel like I'm in a sitcom right now. I just want to get the hell out of here. So that's what the dentist visit is like with Wyatt in the short summary version. I have to hold him down like there's no going back. I mean, this kid is strong. He actually, at one point, he jumped off the chair that he was on, and I caught him, but totally fell backwards with him. So then I get him back on the chair, then I'm holding him down like a straitjacket, and he's wiggling his head back and forth and wouldn't open his mouth, and I honestly don't even know what the point was of this appointment, because there wasn't a whole lot of teeth cleaning going on. The x-ray didn't get done, as usual, and in the end, the dentist just came back over, yeah, he still looks good, all the crowns we put on during the surgery a couple of years ago are still good, and so you want to come back in 6 months? And I just started laughing. And said, yeah, that's a good question to ask me after this torture that I've just been through trying to hold him down. But yeah, let's schedule again for another 6 months from now, because I'm so excited to be here. I try not to get too sarcastic and too blunt in these situations, but it's literally taking all of my energy to try to stay happy and stay positive to keep Wyatt calm. So if I'm normally outspoken, well, it tends to be a little bit more to the top when I'm in that situation. So, but they know me by now at the dentist. They just kind of laugh it off too, because they know the kind of stress that I'm put under to do this kind of stuff. And meanwhile, the funny thing was, and I almost started busting out laughing about this too, is there was it's an open room, right? This dentist office, it's an open room, so you have one chair here for one kid, then you have another one a little bit further down, and even the room where the x-ray is has an open door. So there was another family there with another little kid, and I really kind of felt sorry for them because they looked absolutely terrified. So I'm leaning over Wyatt, looking to the sides, looking at that other family over there, and they have this look like, oh my god, what's happening? What are they doing to her kid? And meanwhile, Wyatt the whole time, and that's the kicker of it all, he's cracking up laughing. 6 months ago, at the last appointment when they were cleaning his teeth, he would pass out on me. I would have to hook him up to the vent, he would turn blue, and he would pass out on me. And this time, they're cleaning his teeth, and he's cracking up laughing. I guess it tickles when they do it. I don't know. I'm over him sweating, trying to hold him down, and he's Superman, superpowers, and he's laying there and laughing. Like it's no freaking big deal. It's like, damn it, can you just lay down and get your teeth cleaned, please? Is that too much to ask? So, that was my morning so far. Hence, I'm sitting on this lovely back porch trying to come back down from that high. I really should have picked up another bottle of wine on the way back home, but it's fun. It's fun in a sarcastic kind of way, and essentially all the appointments that he has coming up this month are going to be the same. On the way out, ironically, when we were done with everything, then he suddenly didn't want to leave, because of course they had a train. And Wyatt is obsessed with trains. So he wanted to take the train from the dentist office home and wasn't happy with me that he didn't get to do that. And he threw himself on the floor, and I'm holding onto his cart with his medical gear. And there's only one of me, so I have to wait it out. I sit there, okay, let me know when you're done. No, we can't take the train home. The train has to stay here. Yeah, you're gonna have to walk. I'm sorry, I can't carry you. Meanwhile, he's signing all of this, but because he's not talking when he's overwhelmed, he just starts signing and throwing a fit. So, in the end, I had to just get him out of there. I grabbed him in one arm, pulled the gear with the other arm. Another mom was nice enough to open the door for me, and I just headed straight for the car, and I was like, okay, it's done. We survived. We did it. And I might have to push the next appointment off for a whole year instead of 6 months. Just saying. So that's what it looks like for us when we take Wyatt to his appointments. And it's the same kind of fun when we take him to cardiology, because he has to do an echo, which also means he has to lay on his back. And then there's the gel that they put on, and it tickles, and He doesn't like laying on his back, much less laying still for that matter. So that's coming up this month as well. He has pulmonology to go to. I really need to schedule ENT. I've been pushing it off because they want to do a bronch every year, which also means sedation, going into actual surgery to do that kind of test. Doesn't take very long, but with Wyatt being on the vent, sedation is always a risk factor that we have to consider. So I like to push things off, probably more than the doctors would like me to, but that's just what works for our family. I'm not, disclaimer here, I'm not giving any medical advice, so you know your child best, do whatever works for your family. But for us, if a doctor gives me the option, okay, come back 6 months to a year, chances are I'm going to be coming back about a year and 3 months later, just because I'm not a big fan of routine appointments just to say hi and say, hey, we're still alive. Yes, I managed to keep this kid alive for another year. So again, the sarcasm, see? I can't help it. When it comes to appointment time, it's still a big stress trigger for me. I'm doing a lot better with it. And I just lost connection for a second. Apologize for that. I'm doing a lot better than I used to, but it is something that I have to go into it knowing that I need to really just work on my mindset to stay calm through it, and to also not really have anything else scheduled for the rest of the day afterwards, because I need that time to just, like I'm about to do, as you can see, to just work out and let that go and say I did it and give myself credit for what I did accomplish today, which is a big deal. And I think that's what most of us special needs moms don't do enough of. We take our kids to all these specialists and all these appointments and all these therapies, and it is a big deal to load all that medical gear up to deal with your child's behavior issues along the way. In Wyatt's case, if he's getting overstimulated, then that becomes an issue. He will throw himself on the floor and I can't go anywhere. I'm stuck. Needing help along the way. It's always the scenario of you don't want other people looking at you and your kid having a meltdown and all the medical gear he brings along, but it's inevitable. So I think for a lot of us special needs moms, the important part in the end of it is, yes, these appointments suck. No way around it. And there is some room to modify your scheduling in regards to how far you can push something off. I will tell you right off the bat, and if you've been following me for a while, there are some specialists that we don't see, even though it was recommended that we do. One of them is neurology. With Wyatt's disorder, there are some abnormalities in his brain, but for us at this point, he's not having any particular issues in that regard, so we don't go see neurology just for routine's sake. It's more a question of what can they really do. We can push him through another MRI and see how his brain has changed since the last MRI, but essentially there's nothing they can do anyway. So to us, there's no value in going to these appointments other than stressing ourselves out, and that's simply not worth it. So my point with all this is really know if this is a stress trigger for you and then work around it. It's okay to get stressed out over this because it is a big deal. It is a hassle, and it is mentally and physically draining. But if you know that's how it affects you, then you can also work with that. So for example, I will schedule these appointments at the best time for Wyatt, and that is typically in the morning. And I will intentionally schedule those on school days. Monique, if you're watching, I love you. Thank you so much for all that you do, because I can go to the appointment with Wyatt and then take him to school and have my nurse, Monique, who then takes over, so that I can then take a break and really calm back down and get that stress out through my workouts or whatever it is I do that day to really get back to, okay, it's done, it's over with, we did it. And then at the same time, if I do have to stack appointments back to back, which will be happening this month, that's the only way for me to get it all in within a matter of a couple weeks, I intentionally schedule breaks in between. Theoretically, I'd like to think I do one appointment, go straight to the next one, and get it done and over with, but realistically, I know it's not gonna work very well because after the first appointment, I'll be done, Wyatt will be done, so I know that I need at least an hour in between where we can simply walk around outside, run around, play, goof off, let off some of that pent-up energy. And then same thing after. I don't have anything going on after because I know my nerves at that point are done. There's nothing productive happening again after the appointment is done. So those days are basically blocked out. If I know I have appointments, I get them done and I line them up back to back with some breaks in between, but I also don't have anything else scheduled for that day. And that allows me the chance to say after the appointment, you know what, I've done enough for today. What I just pulled off on my own, taking this kid to all these appointments and working with him through all these meltdowns and keeping on that fake happy face that you always have to put on, which I absolutely hate, like I said, it takes a lot of energy, and it's okay to sit back afterwards and say, you know what, I did that, and I rocked it. And most of us special needs moms don't do that. We go to the appointments and we complain about it, and we just wish for not having to go to these appointments in the first place, but it's just the reality of it. We have to face it. Wyatt has these setups every 6 months. Every 6 months we go through these list of specialists we have to go to, and I don't want to see any one of them. No offense to any of them. I've built my team of doctors intentionally. There are plenty of doctors that I turned away and said, you might be good at what you do, but you're not a good fit for our family. So the team that we have now are doctors that are in line with what our goals are for Wyatt, not just from a medical perspective, but also just from a quality of life perspective and from a not going overboard kind of perspective. We like to keep tests to the absolute minimum. We are not a big fan of any kind of medications because we know there's certain things that affect Wyatt adversely, and the risks versus benefits for medications, for example, is in most cases it's not worth it for him because the behavior issues get a lot worse, meaning breath holding and passing out and having to resuscitate him. So we built that team of doctors that we have right now, and by chance most of those doctors are the top in their field at that hospital. And at the same time, we've built the trust with them where we can say, you know what, I appreciate your opinion on this, but I'm going to say no. And they respect that from us at this point too. So it's not uncommon that I will tell doctors no. It's not uncommon that I will tell them, I know you want to see us in 6 months, but I'm going to push it off to a year. It's not uncommon for me to say, I know this is the standard therapy for autism, ABA therapy, but it's not working for us and we're going to go a different route. The same with Wyatt's speech issues. Speech therapy was the ultimate goal, and we tried it for a while, but it became evident that it wasn't working for him. So we were the ones who said, this is the standard way to deal with these issues with kids with trachs or whatever the case may be, but we also know our kid and it's not working for him, so we're going to go a different route and we're going to introduce signs. And sometimes it's just having the trust in yourself and in your kid and moving forward and essentially telling everybody else off. And I mean this in the nicest way possible. I'm not going up to doctors and saying screw you, right? I don't do that. I might talk like that sometimes, but I don't do that. But I will tell them straight up, I appreciate your opinion, but I don't agree, and I don't think this is a good fit for us, and we're going to go a different path. But that confidence didn't come in the first year or two. That came over time as we got more and more comfortable with Wyatt and figured out what works for him and what doesn't work for him. So I want to encourage all of you special needs moms out there, it's okay to choose your own path. It's okay to say, this is the standard way of doing things for this particular diagnosis, for this particular therapy goal. But if you come to a point where you say, you know what, I've given it a good shot and it's just not working, and you need to say, sorry, I'm done, then have the guts to say it. Trust your instinct. You know your child better than anybody else. And the theory in the book is not the same as the reality. And sometimes that is really scary because you're essentially paving your own path as you go. You don't know what the end result is going to be. When we started signing with Wyatt, we had no idea whether this was going to work. We just knew that everything else we tried wasn't working. So we essentially ran out of options. We tried all the recommendations that we were given and we ran out of options, and then we tried it just because we had nothing else left. The same with the ABA therapy for autism. It wasn't working. Just simply trying to get him to stop a certain behavior and replace it with something else wasn't working. He was doing these behaviors for a specific reason, and what we needed to do was figure out why he's doing them in the first place, and then we could work with it. Not simply stamp him out so that he would fit into society's model a little bit better, so he would be a little bit more acceptable. And I know I'm going on a rant here. I started this out with a dentist appointment, for crying out loud, but it just came down for us, what do we want for him? Forget for a moment what is socially acceptable. Forget for a moment what is the goal from an educational standpoint so that they can go to school and they can fit in mainstream. Take a step back for a moment and just look at your child right in front of you. What do they need? What do you want from them? Who do you want them to be when they're an adult? When he's an adult, I don't care whether he started kindergarten at age 5 or at age 6. That's not going to matter to me then. What's going to matter to me is that he can function on his own, that he can live an independent life, that he has good manners, that he has respect, that he can advocate for himself. So do I care at this point when he learns his numbers and when he learns to read and even when he learns to speak? No. And that's the decision we had to make in the end was, yes, there are all these paths laid out for all of our kids, special needs or not. All these paths are laid out on when they're supposed to be doing what. But we often forget to just look at the bigger picture of who do we want this person to be when they're 18 and moving out of the house. And those are the types of decisions that we had to make, and it became crystal clear with Wyatt. I mean, we should have done this with all of our kids in the first place, and for the most part, that's how we approach our parenting in general. But with Wyatt, it just became crystal clear because we had these medical obstacles, because we had the speech issues. We had to set goals for ourselves that were essentially separate from the medical world and separate from the goals that a school might have, and just go after what do we want for him as an individual. What does he need as an individual? And that might not be the standard advice. That might not be the standard therapy approach. That might not be the standard school approach. And I can go into this, for a good another 3 hours, explain to you how we got him into the school that he's in now. It was a battle, but it was worth it because it fits his particular needs. And that's what it comes down to. But I'll leave it at that for now because I know I've kind of rambled on. Now I started with the dentist story and now it goes into all the medical directions it can possibly go into. So if you're interested in hearing more about that, if you want to know how we got him into the school he's in or how we make our decisions in regards to what treatments to pursue, what specialists to pursue, how to schedule everything, how to keep your sanity and all of that. If you're interested in any of that, let me know in the comments below. I will go through them later on, and I'd be more than happy to chat about it. I'm an open book. I might not be the most conventional way of doing things, but I approach it from a standpoint of what works for us, for our family, and you can take from it whatever you'd like, and I'd be more than happy to give you some more examples of how we do things and why we do things. So I'm going to go do my workout now to get off this dentist story issue that's still kind of wrapped up in my head. I'm glad it's done. I did it. Yay, Wyatt did it. His teeth got semi-cleaned. And we don't have to go back for another 6 months or maybe a year. Talk to you soon. Bye.